You wake up, stretch a little, and there it is. That stiffness, that tiny jolt of pain in your knees or hips. You chalk it up to aging. It's normal, they say. But what if I told you there's something quietly eroding your joints every single day, and no one warned you? Not your doctor, not your health magazines, not even your physical therapist. It's not your diet, it's not arthritis. Not exactly, it's something much sneakier, and it begins the moment you open your eyes. In this video, I'll reveal the science, the symptoms, and most importantly, how to stop it. Stay with me. Your joints depend on it. Let's start with something simple. What's the first thing you do when you wake up? Maybe you check your phone, or slowly swing your legs out of bed, or sit there thinking about coffee. Seems harmless, right? But here's the harsh truth. The first 60 minutes after waking up can determine how fast your joints age. You might think the worst thing for your joints is running a marathon or lifting heavy weights. Wrong. According to a 2021 study from the Journal of Clinical Rheumatology, the first hour of the day is when synovial fluid, the lubricant for your joints, is at its lowest viscosity. Think of it like cold honey. When it's thick and sluggish, it doesn't cushion your cartilage properly. That's why so many people over 60 wake up stiff or in pain. Their joints are literally unprotected. Now here's the destroyer: sudden, unsupported movement. That means jumping out of bed, bending to grab slippers, twisting to pick up your dog. These tiny motions, if done before your joints are warmed up, begin to microscopically erode the cartilage. And it happens every single morning. I didn't know this until I noticed my own knees cracking every time I stood up. I thought it was just old age. But when I changed my first hour routine, the cracking stopped. So here's what you need to do. Don't rush. Stay seated at the edge of your bed for 30 to 60 seconds. Breathe deeply. Gently stretch your ankles and wrists first. These areas stimulate circulation. Drink a glass of warm water. It jumpstarts your lymphatic system, which helps remove inflammation. It sounds simple, but it's your defense against what no one tells you. Your mornings might be destroying your joints. Now let's dig deeper. You've probably heard of arthritis, but what if I told you the worst kind is the kind you don't feel until it's too late? It's called low-grade chronic inflammation, and it's sneaky. No visible swelling, no redness, no screaming pain, just a quiet ache that comes and goes, until one day it doesn't go. In a landmark study from Harvard Medical School in 2019, researchers found that low-grade inflammation in adults over 60 was directly linked to joint degeneration, even in those who felt perfectly fine. Why? Because inflammation works like acid. It slowly breaks down your cartilage, weakens the surrounding ligaments, and changes the shape of the joint capsule itself. Here's the catch. It's often triggered by everyday habits. Let me tell you mine. I used to drink orange juice every morning thinking it was healthy. Turns out the high sugar load spiked my CRP, C-reactive protein, a marker of inflammation. I never felt it immediately, until 2 months later my fingers started to ache every morning. I also had a habit of staying seated for too long, watching TV after dinner without stretching. Guess what? My hips started to protest. And the worst offender? Stress. Yes, the emotional kind. Stress increases cortisol, cortisol fuels inflammation. And inflammation, well, you already know the ending. So how do we fight this silent destroyer? Cut out hidden sugars, especially in healthy foods like fruit yogurt, juice, granola bars. Add omega-3s, fatty fish, chia seeds, or supplements. They're anti-inflammatory warriors. Move every hour, even just standing and doing 10 knee lifts while brushing your teeth. Breathe. Try 4-7-8 breathing in the morning and at night. You don't need a perfect body, you need an informed body. All right, this one shocked me the most. I always thought sleep was when the body heals. Turns out it can also be when your joints get secretly misaligned, night after night. If you're over 60, the cartilage in your shoulders, knees, and hips is already thinner than it used to be. That means less protection between bones. So what happens if you sleep on your side with no support between your knees? You create joint compression, especially in the hips and lower back. Over 6 to 8 hours, that pressure builds up, leading to stiffness, misalignment, and eventually chronic degeneration. The American College of Rheumatology actually released a report stating that poor sleep posture was a contributing factor in early onset osteoarthritis in seniors. And it's not just hips. Back sleepers who use no pillow under their knees can wake up with tight hamstrings and lumbar stiffness. Stomach sleepers, please stop. Twist their necks for hours, straining cervical joints. Here's what helped me. A body pillow between the knees. It realigns your hips and reduces pressure. Memory foam neck support to keep the cervical spine in neutral. Stretching before bed, especially hip openers and hamstring releases. And most importantly, no late night scrolling. That tech neck posture doesn't disappear when you turn off the lights. It lingers, even while you sleep. Your sleep should be your healing time, not your hidden danger zone. Okay, brace yourself, because this one might sting. There's one thing many people over 60 consume daily, sometimes thinking it's harmless or even healthy, that is quietly drying out their joints from the inside. Caffeine. Yep, your coffee. I love it too. Trust me. But here's the truth. Caffeine is a diuretic, which means it makes your body expel more water. And guess what's made up of 70 to 80% water? Your cartilage. Without adequate hydration, your joints lose their ability to absorb shock. They become brittle. And over time, they start to grind. The dreaded bone-on-bone feeling. In a controlled study at the University of Alabama, adults over 55 who consumed over 300 milliliters of caffeine per day showed accelerated joint cartilage thinning in MRIs taken over a 12-month span. Now, I'm not saying ditch coffee entirely, but be smart. Limit to 1 cup in the morning. Match each cup with a glass of water. Try herbal teas with anti-inflammatory properties, turmeric, ginger, peppermint. Add collagen or hyaluronic acid supplements to restore joint hydration. Don't let your daily drink become your daily destroyer. If you've made it this far, your joints are already thanking you, because awareness is the first step to healing and prevention. You now know what no one told you. That small, daily habits, from how you wake up, how you sleep, what you eat, and even how you drink your morning coffee, can shape the health of your joints for years to come. If this helped you, please hit that subscribe button. There's so much more to uncover. More myths to bust. More healing to discover and are together. Your body isn't broken. It's just waiting for the right knowledge. So let's keep moving gently and wisely.